afternoon, and good evening, everyone. Welcome to another week of Global Café from a rainy Toronto. So, apologizing in advance if that impacts any Wi-Fi. But my name is Roxana, and today I'm very excited to be introducing you all to Ms. Shusmita Rashid for the topic of From Theory to Practice, Implementing Technologies for Older Adults in Everyday Life. A very timely topic given all the advancements with technology. Now, I know, Sushmita, you'll be joining us at the conference in South Africa as well, but thank you so much for taking your time today to meet virtually as part of our Global Cafe sessions. So perhaps to begin, a little bit of a background on Sushmita. She is a healthcare leader and strategic communicator with over 15 years of experience translating research into real-world impact. As the Director of Knowledge Mobilization and Strategic Relations at the Center for Aging and Brain Health Innovation and the Baycrest Academy for Research and Education, she leads cross-sector initiatives that support innovators, healthcare organizations, and end users in co-designing, adopting, and also scaling impactful solutions. With a strong commitment to driving systems level change, Sushmita has delivered knowledge mobilization workshops to local and global audiences, as well as consulted on several large-scale health service research and innovative projects. She is also implementation science subject matter expert for the Gates Foundation and serves on the board of directors for the International Federation on Aging, the IFA, advancing research, innovation, and policy to improve health, social, and economic outcomes for individuals and communities worldwide. So more than anything, Shusmita is committed to translating research into kind of implementation and real-world impact. So thank you again, Shusmita, for all the incredible work that you do. And now I'm actually going to hand it over to you. So can you tell us a little about yourself with your incredible, achievements in the field of health, older adults? Can you take us with you in terms of that journey, both on a professional sense, but also personally on the different areas that have led you to where you are now today?
Perfect. Thank you so much, Roxana, for that introduction. And thank you to you, Luana, and the whole IFA team and the audience for this opportunity to come and share some insights today and hopefully exchange some ideas as well with the audience. And I think I absolutely agree. This topic is so timely, especially with the advances happening every day and kind of staying on track and being almost ready for the future and now. So this idea of how do we make sure that all of the advances and research and innovation get into the real world are really meant to be advanced in a way that makes sense for older persons living in the community, in their homes, or in care and social care settings. And over kind of the past 15 years, my work has involved ensuring that great ideas and advances don't just stay in research papers or guidelines or sit on the shelf, but really they reach people that they're meant to help. And all of the research innovation is translated into a way that makes a real impact in people's lives. And at Baycrest and Center for Aging and Brain Health Innovation specifically, my work has involved connecting researchers and innovators with older persons, care providers, caregivers, so that they can collaboratively test and scale innovation. And when I say innovation, they could be products, programs, services, or policies that are really meant to help older persons and those who care for them. And it can be anything from, for example, a memory care tool to be used in a long-term care environment, or a app that a person can be using from home, for example. And for any of these different types of innovations or technologies, the key questions that we always try to consider is, and I'm always asking whenever I'm meeting with innovators and researchers with really great ideas, is does the solution work? For whom? In what setting? Why or why not? how might the solution need to be adapted so that they better meet the needs of not just some, but many. So what does that look like? And that process has been really the driving force behind my work, is trying to understand, how do we make sure technologies are designed in a way that consider those types of questions. And because we know what works in a lab or what works on paper might not work in a busy hospital care environment where the clinicians are trying to, in the middle of a busy shift change, trying to manage many different priorities, or for an older person or a caregiver who is, managing work life with providing care. So it might not work in those settings unless they're designed to be really considerate of those circumstances and barriers. And what drives me is really this belief that older adults deserve more than good intentions. So there might be a really good solution, but if it does not fit into their lives, their daily routine, their habits, and how they live and work, they're not going to get the benefits from those technologies. And my work has been really focused on connecting the dots between the research, the practice, and the policy to make that happen.
No, thank you very much for that. I think there's a lot of important pieces there, and the element of co-design with older adults really came through from what you just said. But I guess before we move into more of the technical aspects of today's discussion, I would love for you to help us set the scene a little bit. So when we speak about technology in the context of today's discussion, what does that, mean? What does that include, from artificial intelligence to electronics or other tools, and essentially anything in between? Can you provide us a little bit of context, please?
Absolutely. So I think you've set the tone really well around what technology could be. And I think oftentimes when people hear technology for older adults, they'll get, the picture of the VR headset or the robot or smart watches. And really, technology can include both. It can include high-tech tools like AI platforms or fall detection sensors, and more of the high-tech gadgets and products and tools that are out there in the market. But they could also be low-tech supports, voice amplifiers, or things that help with persons who might have vision or hearing challenges. They might be things like, time devices like a timed medication dispenser. And it's at its core, it's really technology is any tool that makes life easier, safer, or more connected for older persons. And that could be high tech or low tech, but really it's meant to be making lives easier for older persons. And the other thing that we hear a lot in the work that we do is, while technology can do a lot, it's not meant to replace human relationships or human connection. It's really meant to augment and support that. And so for example, a virtual companion may help ease loneliness, but it's not a substitute for a real hug or a conversation. And that's what we've heard when we work with older persons directly, asking them about their perceptions and perspectives around technology and solutions. And what we found is that the best technologies give high quality and timely information so that it frees up caregiver time to be able to do more meaningful interaction and more provide more connected care. And it also helps older adults engage on their own terms. So this kind of concept of technology does not replace, but really augment that personal connection and that the things that people are looking for when they're seeking support.
Thank you very much. So technology is a tool, not a replacement.
Exactly.
Wonderful. And with your background in knowledge mobilization and cross-sectoral kind of initiatives, where does technology fit into this space? So in practice, really, how can technology just enable more effective collaboration across various sectors, particularly in the healthcare and older adult space?
So absolutely, I think there's so many examples where technology can act as a bridge. So in an often fragmented health and social care system. So we have at the Center for Aging and Brain Health Innovation, CABI, supported quite a few platforms that allow older adults to connect with family caregivers, hospital care teams, members in their community, to be able to share some of those real-time updates and coordinate care and supports more effectively. So that whole idea around care coordination, navigation, and technology can help in the way that they make those connections in real time, provide updates, make it easy for people to use. But tools like that, what we found, only work if they fit into how people actually live and work. And that's why co-creating with everyone, what we call end users across the system, is so critical, so that that collaboration and that coordination can happen. And there are different ways we can think about how to do that. But it's so critical to make sure that everyone who is involved in using a technology is engaged very intentionally from the very beginning, and not just at the end for feedback. It's really, they are partners in that innovation design journey for that technology to be successful.
No, thank you very much. And it sounds like there really is no shortage of innovations and innovative technologies out there. But I'm curious to get your thoughts on barriers to getting them in practice. And from your experience, what are the biggest gaps between the design of technologies for older adults and their use in everyday life? I think you kind of hinted at some just now there, but if you could maybe touch on a little bit more some of these additional barriers, whether it's access, usability, cost, in which older adults may face, in addition to kind of some of the other points that you just mentioned.
Absolutely. So I think the idea, like you mentioned, there are so many solutions out there. Innovators are creating new solutions daily. But what makes the ones stand out, and even if a solution is designed properly and with all the relative kind of considerations, there's a difference in how they're designed and how they're actually used in the real world. So if we go back to that care coordination platform as an example, so on paper it sounds like a really great idea. It's supposed to provide real-time updates, letting care teams know, and family caregivers know how to care for their loved one, and what are kind of some of the things that they need to consider in terms of providing that timely and accurate care. But if that solution, for example, it's a platform that needs to be used, clinicians may not actually use it if it doesn't sync with their existing workflow and processes and how they use their electronic health records, for example. They might have habits in place that they are more used to using some other form of collecting that information. So if that's not designed in a way that those systems talk to each other, clinicians won't end up using the solution, no matter how great it might be. Most importantly, from the perspective of the older person themselves, they might not use that platform if the interface is too complex or complicated to use, if it's something that's in a language that's not their preferred language, if it's designed with features that are not intuitive to use, or something that takes into account their lived experience and how they interact with technology, then it won't be successful. Similarly, caregivers themselves might find that it's overwhelming to use this new technology. And I think even from an organizational perspective, differences in the setting, whether it's a rural or urban environment, if they have access to things like, the basic infrastructure, like consistent Wi-Fi, IT support to troubleshoot if there are challenges. So these are all things that can be barriers in terms of using a technology. But I think the other really critical point here is from an equity lens, if a tool requires using expensive devices or digital literacy and access, and those things are not considered, they might actually not be inclusive of the people who need them the most. So the thing is really, again, to deeply understand the circumstances and barriers from all of those different perspectives, whether it's from the organizational side, a clinician side who's meant to use the technology, whether it's from the caregiver side or the older person side. All of these different groups might have different types of barriers. So thinking about those from the very beginning and asking proactively when designing the solution. So the solutions are really designed to address those from the very beginning. That's critical for the solution to be successful amidst all of the things that are out there.
Thank you very much. And I guess tying what you just said with one of the questions in the chat. So Mr. Shmuel Yerushalmi, a continued Global Cafe attendee, wants to know a little bit more about perhaps some of I think some of the challenges that you mentioned, but also opportunities specifically for poor and low socioeconomic groups, and if there are any differences that you could perhaps talk on a little bit more.
Absolutely. That's such a great question. And thank you for the question. And I would say there's a few things that organizations that support innovation, like CABI, but also innovators themselves can be doing to think about those types of challenges. So oftentimes people will design for what they think, or they almost have this sense of this is what the needs are, or this is what kind of they kind of design it based on an assumption that most people are wanting this type of solution, or they need this type of access, or whatever it might be. But it's one of the things that we really get innovators to think about, that this co-design is not a checklist or a checkbox kind of process. It's a mindset. It's thinking about when older adults and users across the system are being invited to be builders or partners in that innovation design, and making sure that we're not just asking, one group of one community or one group of individuals to kind of comment on what the needs are, but thinking about how might we engage groups from as many diverse backgrounds, diverse communities, different lived experiences, and asking them the different questions, and being able to design in a way that a solution addresses those different needs and can be adapted to different use cases, different settings, and different contexts, because we know that a solution that works in a rural environment might not work in one country, might not work in another country. So how do we adapt it to make those changes and meet the needs of the diverse users in a way that is really meaningful to them? And the way we do that is not by, there's no one size solution that fits all, but it's really thinking through, this is maybe the first iteration of a solution, taking it to the different locations, getting real-time feedback on what's working, what's not working, how might it be adapted to meet the use case and preferences of that audience is really critical. And that's something we encourage through the work that we do. So for example, we have a community at CABI called LEAP. It's a community of older persons who provide real-time feedback to innovators who are designing solutions, so that they can get that early feedback around, would someone use this? Would it work in their context? What would they pay for it? Or, what are some opportunities for cost savings for it to be cost effective, used in a way that meets their needs? And these are some of the critical questions that are discussed in those sessions, so that an innovator who's designing a solution can incorporate some of that feedback before they go to scale. So they don't go, investing a lot of time and energy into creating something that ultimately won't be used, but by engaging through these LEAP engagements, they're being able to connect with communities of older adults with lived experience, but essentially those who have diverse experiences, because that's one of the critical areas of focus, is making sure that we're asking as many people from different backgrounds and different experiences what their preferences might be, and that the innovator is using that information, incorporating it into how they refine the ultimate technology they're developing.
Yeah, no, that's one. Thank you very much for that. And thank you, Shmuel, for your question. Now, in light of some of these barriers, I think the digital divide is definitely a topic that needs to be discussed. And I know Eileen from Ireland had a comment in the chat regarding the digital divide as well. So I was wondering, Eileen, if you wanted to unmute to perhaps speak a little about your comment, and maybe we could tie it into how we can more effectively address the digital divide altogether.
Oh, thank you very much. This is an excellent Global Cafe, and really thank you for all of your comments. Yes, myself and one of my colleagues here on this Global Cafe, but it's nearly 10 years ago we started with an age-friendly tablet, which was designed by older people for older people. And I'm one of the people who are still using that tablet, but it has moved on. It's now commercially available. But on the digital divide, it's interesting. I'm over the last 10 years, everything has been digital. The policy of the government is digital first. And from an age action activist, older persons group, we want is not digital only. But it's nearly impossible. The whole life administration type work and tasks is all around having smartphones, which a lot of people don't have proper internet connection. And then as you go through the life course, I personally think, without any research, just an observation, that the actual digital divide, even though you may be 100% and love digital, as you grow older through the life course, you're no longer using it for various reasons. And then the technology is changing. You can't keep up with it. You don't have the help at home. Have you done anything on that that's worth sharing with us, just on, I like your word, it's a tool, not a replacement. Thank you very much.
Absolutely. Thank you so much for that question. And I think you've raised such excellent points around why it's challenging. It's that tension between, technology can make lives easier, but then is that really true? Like almost kind of testing that assumption. And I think the way, we thought about it is thinking about, I think it's so true as older persons, especially those who might be experiencing mild cognitive impairment or potentially dementia, early stages of dementia, it might be more challenging for them to use certain technology and tools. And thinking about that is something, that might be one of the use cases is how innovators can expand their vision around, we're creating this technology for this type of older adult who has cognitive ability, has access to, troubleshooting if they need to be able to, troubleshoot and get through the features. And what we do is we encourage all of the innovators, especially with our focus on aging and brain health specifically, and dementia, is thinking about how will the solution be used for those populations who might not be able to access them? Are there additional features that can be included that make it easier? Memory enhancement tools or things that can be embedded as cues so that it's easier for older persons to use things. And if you are making changes, we all know this, anytime our iPhone goes through an update, for example, or there's things change, or even Zoom, we're all connecting here today on Zoom. Zoom creates updates and we're all kind of trying to figure out, why did you change, one of the buttons that used to be here and now it's here? Like these are all kind of very practical challenges that everybody experiences. And I think for good design, it's making sure that these are being tested, and there's a lot of cues and behavior cues and ways that the design is making it easier for people to be able to navigate those changes or be able to use it what they're used to, like be able to kind of use the interface the way that you prefer, your preferences are, you design it that way and don't change it. So that's something that we really do encourage, but it's such a good point and something we find in a lot of our focus group discussions when we're asking older persons. One of the key messages and consistent messages is keep it simple. don't add all the bells and whistles and features that you think are going to make it great. It's like, it's just going to make it more complex. So they really, more often than not, the feedback we get is, streamline it to keep it as simple as possible, so that, people are not having to navigate through different things, and it's easy for people to use, and they can form these habits. And they can maintain these habits so that that tool is used in a sustainable way. It's not something that someone just uses for a couple of days and then forgets about it and leaves it on the shelf. So that's really some of the things that we find, but it's very true, and very important to think about those issues for sure.
Well, thank you very much, Shusmita and Eileen, for your question. I know, Anna Maria, you have a number of kind of comments in the chat, including the aspect of like technology contributing to reduce seniors' social isolation and loneliness. So I was wondering if you wanted to speak a little bit about some of your comments and if there were any questions you had for Shusmita on that front.
Okay, sure. Thank you very much. And I agree with the previous person that technology is a tool, not a replacement. However, I think from COVID-19, the greatest benefit left to us was the use of technology in delivering program for older adults. Technology is a facilitator to unite and connect older adults or any generation across the globe. But the success in making this contribution very effective and reducing public health investments is those who deliver the programs. I have made comments of two organizations, one in Canada and the other in the States. In Canada, we have the Dancing with Parkinson that went online because of COVID, and is uniting people with Parkinson across Canada, but also older or seniors. But now they are integrated people who live in senior residence as well with the schools. But it's the people who deliver the program that make a difference as well. I have a neighbor that I met 2 years ago. He was struggling in the summer with the company of his daughter, sorry. But last summer and this spring, I already met him walking by himself with a walker and assisted. To me, it warmed my heart. It brought me to tears. And he said that he's very grateful to me because I connected him with Parkinson, Dancing with Parkinson. But in the same way that he gets benefits, a lot of people get the benefits. And it doesn't matter that we are far away, that is the screen that connects us, but still we feel the love, the caring, the compassion, and the resilience of all of us who connect. That is from Canada. In the States, there is one organization that I admire the most, and we Canadians should learn from them. It's called Senior Planet. They offer programs from Monday to Friday, sometimes until 8 o'clock in the evening. Mind you, only one registration, okay, with both organizations, one. I am connected with them for 5 years. It's the same registration. So one particular class at 10 o'clock in the morning get over 700 seniors connected. So what is the message? And there is a great connectivity, great compassion and love, and we care for each other. So I find that the governments are not using education and trying to close the gap, because we could benefit more. We have more people connected across the globe, because for some here in Canada, 25 too many. And in the state have over 700. So how we can promote, my question is, how we can convince or create more awareness with the government that technology is a great tool to deliver programs that reduce senior social isolation and loneliness. Thank you.
Thank you so much for those comments, Anna Maria. And I think you've hit on some really critical points. And I appreciate those examples. And at the core of, I think, what's resonating with me is this idea that by engaging in these types of workshops, so for example, the Senior Planet, and even if they're virtual like we are today, those are opportunities for community building and relationship building. And that's why it goes back to that idea that we're creating habits where people feel comfortable to join and engage and feel empowered to share their voices, share their perspectives. And that's why when they are in these types of engagements, what it would be a small or in a larger scale, they have almost a vested interest in the topic that's being discussed, and they feel they're more likely to be using, the programs that you mentioned or using the technology that they're discussing because they feel like they're part of the process. They're not an afterthought. They are the ones who are from the very beginning driving those directions around, what's important, what should these workshop topics be, what are the education needs, rather than oftentimes a lot of education is being delivered because, that's what people think people want to know, but asking actually the learners themselves, like what are topics that you're interested in? What are the areas and gaps you have or you would like to learn more about? And using that to then drive that education delivery, the topics. So even co-designing what are those areas of research or areas of education or learning that these groups can be delivering is critical. And I think there's some examples of how we do that. So I'll give you one example. One of the programs we support from the Baycrest environment is really called this Defy Dementia. It's a series of knowledge products. So a podcast series, it's 1-minute videos, it's infographics, things people can print out and just learn about the risk factors of dementia and dementia prevention and what they can be doing. Very, very tangible and actionable tools, but these are shared. It's a way of sharing this education in a way that is designed by the older persons themselves, the people who want to know, the questions, the topics are really determined by the users around what is it that they want to learn about, what are some of the questions that they have, and that goes in the beginning of designing kind of the content that is delivered through that Define Dementia series as well. And I think that's such an important point, that through engagement, through discussions, through these co-design, we're also building community, we're combating some of the challenges with social isolation as well. So I think that's a really, really excellent point. Thank you for sharing, Anna Maria.
Thank you. Thank you both very much. I know Isaac also in the chat, you have a question if you'd like to unmute to pose your question.
Yes, hello. Thank you very much for this opportunity to speak. So my question is related to the topic of digital literacy that we've been speaking about. And like was mentioned towards the beginning, that we do live in a very digital world today, and our technologies are becoming all-encompassing for variety of our day-to-day lives. So like the person from Ireland mentioned, the digital first idea that all services should go digital. And especially with the newer generations today, by being digital natives, they have those digital skills. So my question is regarding the fact that maybe we might not have the ability or opportunity to take a step back and reflect on how digital technologies affect all ages, in this case, older adults. Um, what sorts of things would you share or say that could maybe open someone's eyes to the importance of human-centered design for technology for older adults, and maybe inspire them to reflect more on how to make technology more accessible for older adults, and then I guess for all ages as well. Yeah, thank you.
Absolutely. Thank you so much for that question. And I think you've really highlighted this idea that it's not like flipping a switch and suddenly everybody will be using technology in the way that they maybe even governments maybe intend for technology to be used. And I think the other piece is really critical is that human-centered design. So really meeting people where they're at. So offering options and choices. So when solutions are being designed, how might this be used by people who have high cognitive function, are able to use it in a certain way versus how might it be designed to account for those who might have accessibility issues or perhaps with vision or hearing or cognitive ability. So thinking about those different use cases and scenarios. And whenever we are engaging innovators that we fund through our Center for Aging and Brain Health Innovation, CABI, we ask them to consider these questions from the very beginning. So when they're designing a solution, they might say, we are designing something for this environment, these users. And oftentimes it's very broad. It's like, we're designing a solution for older persons. So we then ask them, what demographic of older persons are you designing this for? What is their age kind of range? What is their kind of lived experience with technology use? Are you designing it for people who are very, like you said, the digital natives who know how very easily have that digital literacy and can kind of use it as is? Or are you thinking of what features, design elements you might need to incorporate for those who might not have that ability to use it in the way that it's intended? And what features are you including to be able to make it more accessible for those who might have challenges with vision? Are you making the screen, the text size larger, the font size larger? Are you making it so that it's easier there's a kind of voice activated thing so people can hear instructions rather than have to read them, for example? So lots of these questions come up, and oftentimes innovators who are, they have, again, good intentions. They have these really great ideas. They have really good intentions, but when they're posed with these questions that we're asking them, or not us, but it's really the older persons themselves who are asking those questions, it makes them really reconsider and refine some of those solutions. And they find by doing so, they're creating a better product market fit. They're creating a solution that's actually going to be used, that's actually going to help people, that's not just going to, again, sit on the shelf or go unused or be one other item in the market that nobody actually uses, but they're designing something that's fit for purpose, fit for actual, be able to kind of fit into people's everyday lives. And that's why human-centered design, through things like co-design sessions, focus groups, connecting those innovators with older persons. Oftentimes we'll hear, yes, we spoke to our grandparents and, we're an innovator where we spoke to our grandparents and their friends and we got all the input we needed. And we're like, no, you need to ask a lot of individuals from different backgrounds and diverse communities and really fact check if that's going to work for everyone, and really, think broadly how it might be addressed. And that's where we can help them broker connections to those different communities and get those different types of input for those different types of insights.
Well, thank you very much, both Isaac and Shusmita, for that response. I know the chat's, there's a lot of great questions in the chat and comments, and I saw one from, I believe it was Valerie Powell, and she was saying how, technology changes so frequently as well. So in addition to the person-centered care approach and co-collaboration, how can, I guess, we keep up with the frequency and the consistent changes that are occurring with AI, with technology and everything else?
Yeah, that's such a good question. And I think especially in an environment where we're seeing, with AI, like every day there's something new coming up and there's different ways it can be incorporated. And I see it as two different ways of looking at it. So oftentimes we'll have people ask, with all of these AI advances, how are we incorporating some of them into our existing tools to make them better? Because they can make them better. Things that were done manually before that required a lot of time and effort and energy can now potentially be done in a much faster, quicker, more efficient way. So, that the positives of AI, how can it be incorporated in a way that makes sense? So that's one kind of side of the argument. The other side is, how do we do this well, and how do we make sure that we're not doing this in a way that has unintended consequences or repercussions around how AI is being integrated into daily life, and how do we make sure that we're not leaving people behind as we're doing these rapid investments in the technology space. And I think the way to think about it, or the way that I think resonates, is that it's building and scaffolding on what people already know. So it's not that, again, it's not flipping a switch that, one day we know this and next day we're going to change it all. It's really building on where people are at, meeting them where they're at in their level of understanding and engagement with technology, seeing how, based on where they're at, how supports can help them get to the next stage, and using a phased approach in helping them get more used to using changes. So not create a whole drastic kind of change process, but thinking about giving options and giving opportunities for people to build on their skills. And I think there's so many examples of, pre-pandemic, did everybody use Zoom? Did anybody know what Zoom was, right? Like, versus now, think about how much progress has been made in the last few years in thinking about that. And that hasn't, again, it has happened over continuous, sustained use of ways of connecting. And I would say I'm an optimist. I believe there's, given the different types of ways of looking at it, it's almost that it's not that AI is coming, it's already here. But there might be ways for us to incorporate it in a way that makes sense for us and is meaningful for us, and is helpful in meeting us where we're at. And if people can think about it in that way, it's not necessarily something to be fearful of. It's really thinking about how can it help, and but being also obviously cautious about what it is that we're doing, so we don't get those unintended consequences either. So a bit of balance is what I would say.
Oh, absolutely. Thank you very much. I know there's another question in the chat on privacy, so perhaps I'll hand it over to Jean Bank if you're able to unmute to pose your question.
Yes, thank you very much, and excellent discussion, and congratulations on the work that you're doing. I think one of the barriers that prevents people from getting involved with tech is the whole issue of privacy. I mean, the amount of scamming. I got 2 scam calls yesterday myself. It's just constant, and people are afraid about signing on for some things. I'm just wondering, based on some of the work that you've done, can you give us some examples of how privacy or protection of personal information is built into some of these programs? Thank you.
Absolutely. Thank you so much for that great question. And I will say, of almost all of the focus group discussions where we bring innovators with older adults giving kind of feedback, privacy is one of the top topics that rise to the surface. Everyone asks, I'm putting in all of my information. How do I make sure that it doesn't get into the wrong hands? It's not used in inappropriate ways, that we're not privy to scams. And as we know, like, these scammers are getting better and better in creating, infiltrating a lot of technology, which is almost alarming in some cases. So it is something that comes up often around how is a technology really protecting privacy. And it's one of the key things, not only do the older persons in our focus groups highlight, but it's something that we encourage innovators to be really clear about and transparent about. So being really clear in when they're sharing their solution or technology, what is being collected and why? How is it being stored? Who is getting access to it? How will it be? Will it be something that's saved? Will it be deleted after a certain time? Like, being really clear on what those policies are for that solution, so that any person who's making a decision to now use that solution has that information in a very clear and transparent way. It's not hidden. And that creates that trust, that creates that situation where an older person will more likely use something if they feel that they can trust that the solution will protect their privacy, will keep their data safe. And if they're not able to communicate that, that's a challenge. If people are having kind of doubts around sharing their personal information, they're not going to share it, they're not going to use it. So it's really being encouraging innovators to be really transparent about what those policies are. And if they haven't thought about how to make that, there's lots of really good examples where and guidelines on how to be really clear on making sure that the data is being protected and kind of encouraging them to do that as well.
Thank you. Thank you very much, Jean, for that great question, and Shusmita. And following that kind of concept of privacy and echoing a question in the chat, Shusmita, do you have any tips perhaps on ways that older adults, all of us, everyone can ensure that, we're being safe and our data is keeping, it's the privacy aspect is there. If there are any tips that we can keep in mind, that would be very appreciated.
Absolutely. It's such a good question. And I think it's something, to your point, Roxanne, it's something that everybody deals with, right? There's so much information out there already. Anytime we're using a device, anytime we're connecting, there's a risk associated with our information getting leaked potentially. So I think one of the things that we really think about is looking at some of those cybersecurity courses online or examples that you can kind of really get the knowledge and know-how around how to protect your safety and security and privacy online. And there's some really good examples of those courses that you can take to be able to think about, what are the top 10 things you should avoid when you are engaging in an online platform or a digital platform? What are things to be aware of? How to find details around the privacy policy, so you're aware of how is your information being collected, why, for what purpose, how long is it being stored, who has access to it. So making it really, that's part of the learning around being digital literacy, like also how to protect your own privacy when you are engaging in digital solutions. So that would be my number one, trying to find some of those examples and really think about how be more aware and conscious of what might happen and how to safeguard against those challenges and cybersecurity threats as well.
Yeah, no,
exactly. I think some really good examples on the chat I can see as well, some great solutions and suggestions there.
Yeah, no, absolutely. And just on that front, I also want to thank everyone for your great comments and insights. I know Francis, there were quite a few great insights from Stanley Shi as well. So thank you everyone for your comments there. And we are slowly coming close to an hour, so I do want to make sure I kind of capture some of the discussions that we've been had, but if we think about, let's say, a crystal ball, looking to the future, can you speak to us about how we all can leverage technologies and what small but meaningful steps we can all take, whether as individuals, whether as organizations or communities, to implement and scale technologies that support older adults in just daily life, really?
Absolutely. And again, I so appreciate all the comments and questions that have come in, because I think this is such a nice way to exchange some of those areas of, I think what's resonating with me is this common theme that, technologies need to be tested in the real world, designed for real lives, and really thinking about, that human-centered design, meeting people where they're at, addressing some of the concerns that they have, and thinking about those things really proactively and asking the questions, not just kind of assuming or designing based on assumptions, but really asking the users what they see as challenges and barriers and opportunities also to embed in the design of solutions so that it can really make sense in their context and the way that they live and the way that they work. And when I say end users, it's not just the older persons, it's the people who care, the caregivers, the healthcare providers, the whole system, and really thinking about how do we make sure that the solutions are being designed in keeping in mind all of their different perspectives. And then I think the piece that has come up also is this idea that early and consistent engagement. So again, not just getting feedback after the fact, ideally from the very beginning and throughout the process, but also closing that feedback loop, because oftentimes we'll have, we'll engage different groups and they might feel like they're not seeing how their voice is being heard and how their input is being incorporated. So really closing that feedback loop so people who are engaged, for example, in those discussions, feel that their voice is being heard, their input is being incorporated in the design, and making sure that ongoing communication and collaboration engagement is really key in the process. And ultimately, it's not a one and done thing. It's not something that you can design it and you put it out into the world and you forget about it. It's really, you design it, you test it, you refine it, you adapt it, then you rinse and repeat. You keep doing that until you're really making sure that solution stays relevant, that technology is something that people will actually use, not just for one day, not just for a few days. They will use it consistently as long as it adapts with how people are changing and their evolving needs as well. So kind of keeping that as that it's a cycle of iteration. It's not just a one and done type of situation.
Yeah, no, thank you very much. I think that's absolutely great. And I know there are some other comments in the chat that there are other forms of technology that need to continuously be improved. So it's that concept of continuous change and making sure that collaboration is there throughout the process. So again, thank you very much, Shusmita, and thank you very much to all of our Global Cafe attendees. But as we are close to the hours, I would love to hear, and I think that did a good key takeaways, but a key takeaway of all of the discussions that we had from today, Shusmita. So maybe to allow yourself to gather your thoughts, we are just going to introduce our next week's topic and speaker. So next, oh, sorry, Luana, I think I lost next week's speaker. Is everyone else able to see? Okay, there we go. So next week we have Professor Jolene Skordas on the topic of health equity among older adults. It's going to be a great discussion, so I hope to see everyone there for that. But back to you, Shusmita, if there are in a few sentences your key takeaway for us all today.
Absolutely. So I think, again, thank you so much for the IFA team and the IFA audience and everyone for their engaged discussion, excellent questions. And I think what's really resonating with me is this idea that, some of the key points that technology is meant to support and augment how people receive care and high quality care and feel empowered to use technology. It's really critical to think about how that happens. It's not meant to replace human connection and relationships. It's meant to augment and support. That's been really key coming through in all the discussions. The other piece is being involved in these collaborative discussions, in joining cafes like this, joining co-design sessions, joining the Senior Planet workshops, for example, Anna Maria, you were describing. These are all ways of engagement and being able to be in the know as technology changes. How might we change along with it? What could that look like? What are the possibilities and what are the opportunities? And being involved is one way of really essentially looking at the inspiring ways technology can support our lives, and also while at the same time being conscious of what the challenges might be. And then the last part would be being informed, but also informing and influencing the direction of the future. So engage with discussions with innovators and researchers who are trying to identify, understand there's often so many surveys out there, so many focus group opportunities where they're asking for critical feedback from people with lived experience. And whether that you're an older person, you're a caregiver who provides care, you're a policymaker or a healthcare clinician, you have such critical feedback and insight to share with these innovators. So join in that community of innovation and share your insights so that becomes part of the future of what these solutions are and really sets them up for success. and so they get into the hands of those who need them and really make a real world impact. So that would be my call to action for everyone here, which I think you know, you're already doing, and it's fantastic to see. So thank you so much for that excellent ideas and discussion. Really appreciate it.
Thank you, Shusmita, for the discussions. I guess also before we sign off, I just want to thank again everyone for another great week of our Global Cafe sessions. A special and grateful thank you to you for being such an incredible expert, and all the folks joining us today with your brilliant discussions. Also, a very special thank you to the people who work at the IFA who help run a lot of these sessions, particularly Ms. Luana Colnago. So thank you, Luana, and I hope everyone has a great rest of your Friday and weekend. We'll see you next week.